Millions of people are suffering from depression and can't seem to find a way out.
Yeah, it really affects people from all walks of life in all corners of the world, and statistics show it's on the rise. For many, medications really don't work well enough, and the side effects can be a problem. Now there is a drug-free therapy approved by the FDA, covered by insurance, that is healing thousands of people. It's called TMS, transcranial magnetic stimulation, and one of the world's leading experts on TMS is right here in Connecticut. We met up with Dr. Tariq Pereira and his patients to learn more.
Most of my problems started after September 11th.
Mike Mushlet was a firefighter in New York City during the 9/11 attacks. The horrors he saw led to post-traumatic stress disorder and major depression.
I started pulling away from my family. I started staying away from crowds, having trouble sleeping.
And it got to the point you couldn't work anymore.
Yes, eventually it got to the point where they asked me to put in my papers to retire.
He spent years trying various therapies and medications, but nothing really helped. Finally, after a suicide attempt, a therapist recommended he try TMS, transcranial magnetic stimulation. TMS uses magnetic pulses to stimulate areas of the brain that are underactive in patients with depression.
A big change in my life.
Dr. Tariq Pereira in Danbury is the president of the TMS Society and is treating Mike with great success.
In the more complicated depressions, like depression from trauma, or sometimes even depression because they have a lot of moodiness and up and down moods, or with a lot of anxiety, those kinds of depressions don't respond to traditional antidepressants that well. And if they haven't by the third or fourth time, my recommendation is to really try TMS because the success rates are very high.
The treatment schedule is intensive.
It's 5 days a week for 4 to 6 weeks. We treat until you go into full remission.
Here's how it works. Mike relaxes while the magnetic pulses are set up.
Now this light needs to be right in the corner of his eye. Perfect. And this is the coil where he'll get the pulses. How does that feel, Mike?
It's good.
What does it feel like?
It feels like somebody tapping on your head really fast. I get a little twitch in my eye, but there's no pain.
No pain, but a lot of gain.
You have found this to be more effective than anything you've tried?
Yes, absolutely.
And have you been able to reduce your meds or get off of them?
We've started to reduce them, yes. But there's no side effects. It's only, just benefits.
His wife calls it a miracle.
And I just hope that other people like us find it, because if you don't have any solution, you don't have any hope that it can get better.
Our success rate is about 83%. Now, majority of those patients get well, get completely well. In other words, based on our rating scales, they're free of depression. And of those, only about, over the next 5 years, only about 25% or so may need to come back for some boosters.
TMS is FDA approved to treat major depression, but it's also been used to successfully treat other problems like chronic pain, autism, and eating disorders. It helped Nikki Delventhal. You might recognize her as a contestant on The Bachelor. Nikki's battle with depression started when she was an NFL cheerleader for the Jets.
I was living this life that looked glamorous from the outside, but inside I wasn't feeling that way. All I could think about was body image.
She developed an eating disorder and didn't want to take meds, so she tried TMS.
I would definitely say that TMS is what got me to be recovered.
The ideal person would be the person who gets depressed for the first time and comes and does this, because this is a lot safer, a lot faster acting, and it's time limited. The treatment is time limited. It's not something you have to stay on for years and years and years.
11 years ago, I lost my 12-year-old daughter to bone cancer. Finally she kept saying, "Mama, can I go?" And after I gave her permission, she just stared really deep into my eyes. She had one tear come in each eye, and she just said, "I love you." Took her last breath, and that was it. It was like somebody hit me in the head with a hammer,
Then, 2 months later, Carla's son was nearly killed in a car wreck. Her father died 2 weeks after that.
I didn't want to leave my house. I was afraid. I felt like I was going to pass out all the time, and I had such severe nightmares that I was digging my face really bad.
She says TMS saved her.
But I was amazed, and I mean, I was excited. I mean, I would actually get in the car and driving around, you know.
And to look at you now, I mean, I see joy in your eyes.
Oh, I do. You know, and my family has all said that. Because I think if I didn't come down here and meet them and have this treatment, I don't think I'd be here today.
Some really incredible testimonials. What's really make a difference for patients now is that TMS has had such great success. It's now covered by most major insurance, including Medicare. So Dr. Tariq Pereira is actually located right in Danbury. He also has offices in Greenwich and New York City. We have a link to his office on our website, and you can determine, he can help you determine if this is right for you.
And you just call your insurance company and say, do you cover TMS?
And they'll handle all that for you. If you have a diagnosis of major depression, it's now considered to be covered by major insurance companies, including Medicare, which is huge.
That's huge. Well, great story. All right, a one-of-a-kind event featuring 2 American classics, beer and bacon. Our friend Chef Plum is back. He's a part of it. He's next in our kitchen with more on this wonderful event. Oh, bacon.
Stay with us.